Good afternoon. Not quite sure how many people are here yet. Let me just have a look. Okay, just going to give it a couple of minutes. I'm just going to wait for a few more people to arrive. Okay, I'll give it another minute. I hope everyone's doing okay today. I don't know if anybody's tried any of our sessions before, but welcome. My name is Martine, and I have been a therapist at the Disability Foundation for the last 17 years. I'd like to welcome you all to the Disability Foundation Wellbeing Webinars, which are brand new, and I hope you'll enjoy them. So, just to let you know, today I will be offering you all some self-massage and some muscle stretching techniques. If you're not so familiar with massage, it's an effective way to relieve muscles and tensions in the body, as well as helping to manage stress, worry, anxiety for your improved well-being. In this session, you will be guided through some simple and effective massage techniques to warm up your muscles, relax any tension, and to target any problemed areas that you may identify. By the end of the session, hopefully, you'll feel deeply relaxed and rejuvenated, and you'll have a variety of techniques that you can take away in your own time to practice. Just so you know, for your information, each of our daily sessions are an opportunity to experience different relaxation techniques from our team members. Remember, all of your videos and microphones are switched off. No one, including me, can see or hear you. Yep, that's right. I can't see or hear you. You can only see me. So do what feels right. Just some practicalities that you need to be aware of. Firstly, you all need to make yourselves as comfortable as possible and minimize any distractions, usually the first one being your telephone, so I recommend you to put that on silent. The guided part of the massage session will last approximately 20 minutes and will include me talking you through a simple guided relaxation at the end. So please close your eyes if it makes you feel comfortable. Firstly, I would like you to know that disability is a charity and we rely on donations, so please give whatever you can. Remember to pace yourselves according to your own abilities, and most importantly, work within a pain-free range of motion. If you feel any discomfort whatsoever, please remember that I can't see or hear you. So make sure that you're comfortable, and if you feel any pain whatsoever, you stop what you're doing. Be aware you can stop at any time. So once again, I'll stress, stop at any time if anything feels uncomfortable. You are the one in charge. The session should be finished by approximately 12:30. Please just take note that if you do have any questions at the end, you can get in touch with us by email at therapysupport@tdf.org.uk. Okay, so first of all, I just want everyone to sit comfortably on your chair or wherever you are. I'd like you to have your feet firmly planted on the floor. Sit back comfortably, rest your back on the back of the chair, and relax your shoulders, and just take a moment to take a few deep breaths, relaxing your shoulders, drawing your shoulder blades downwards, bringing them back. Imagine there's a nice silver cord coming from the crown of your head, coming down and pulling your neck up. You have a nice posture. And take a nice few deep breaths in through your nose. And make a nice whooshing sound when breathing out. Okay, so I'm hoping that most of you will have some type of massage oil or wax or cream or lotion or whatever you have available. If you don't, it's not the end of the world. Most of us will have natural oils in our body anyway that we can you can do it without oil. Okay, so we're going to firstly start off. I just want to do a few neck stretches. So if you can put your hand on your heart, you're going to double palm your hand across your chest, and I want you to bring your chin towards your chest and holding, keeping your shoulders down, pushing slightly on your chest so you can feel the chest opening up, and dropping your head low as possible, where you can feel some pulling perhaps around the back of your neck. And again, just hold that. And now bring your head back to the center. Next, I'd like you to extend your head, bringing your head backwards. Again, pushing down gently on your chest, opening up this whole area. And really trying to find those areas that feel a little bit tight and just holding them. Take some nice deep breaths. Okay, and now bring your head back to the center. Next, I just want you to bring your hands down comfortably onto your lap, and just imagine you're going to be looking behind your left shoulder. So just turn your head, and again, feeling any areas that might feel a little bit tighter. You might find it more towards the front. You might find it coming down the side of your neck or possibly down the back of your neck. And just hold that position, keeping that shoulder down. Okay, bring your head back to the center. Next, I want you to turn your head to the right. We're going to do the same on the opposite side. Really imagining you're looking behind your shoulder, keeping this whole area open, shoulder down, feet nice, firmly planted on the floor. Taking a couple of more deep breaths. And then bring yourself back to the center. Next, we're going to bring our left ear towards our left shoulder. We're going to start by taking our right hand, and if you can sit on it, or if you perhaps maybe your chair has an armrest, you can rest it on there, but actually if you sit on it, it will stop your shoulder from hiking up when we're trying to do this next exercise. So I just want you to put your chin, you're going to put your left ear towards your left shoulder and just drop down. And again, finally tuning your head to maybe where you feel a slight deeper pull in certain areas. So you can then take this left hand and place it on the side of your head to help extend that stretch. Now, it often helps closing your eyes and really finding that place of release. You might just want to finely tune your head like a telescope, dropping it down. You might feel a deeper stretch coming down the back of your neck. And we're just going to hold that for a few more seconds. And we're going to bring it back to the center. Now, we're going to take your left hand and place it underneath your left thigh. Take your right ear to your right shoulder and drop down. First of all, feeling the stretch, and then taking your right hand, placing it over the side of your head, and really trying to elongate that whole area. You can maybe drop your head slightly forward, where you might find a deeper pull coming down the back of your neck. Again, finely tuning it. Don't forget to breathe, and just don't forget if anything's uncomfortable, please stop. Okay, lovely. So bring your head to the center. Next, we're going to interlace our fingers like so. And I'm just going to turn around and show you where I want you to place your hands on the base of your skull and lift the tissue, bringing your chin towards your chest. I'm going to repeat that. Take your hands interlaced, bring them underneath the skull, at the base of your skull, lift the tissue and dropping your head towards your chest, really get a good deep stretch. Wonderful. Keep holding that stretch down. Again, thinking about where you can feel the areas that feel tight, noticing. Maybe there's one side that feels more tight. I'm going to keep my fingers interlaced, and now all I want you to do is use the heels of your palm and just work into this whole area, all around the lower part of your scalp, the base of your skull, just doing some nice warming up. Again, going into the neck. That can feel really nice. Just working right down the cervical spine. Okay, I'm going to turn back around. Lovely. So now I suggest it's time that we get our massage oil, whatever you have available. And I'm going to, if you've got an open shoulder, it will be easier. So I just want you just to take a tiny bit, not too much, otherwise you'll slide all over the place and you won't actually get a good grip. Okay, so just place a small amount and we're just going to gently just start warming up our muscles, trying to get as far as you can between your shoulder blades. Now remember, everybody is going to have a different flexibility, some people are going to be able to reach in different areas. So if you can't reach too far back, don't worry about that. Okay, so just really, really warm up those muscles, trying to get in there. And again, noticing any tender spots. And when you find those tender spots, just kind of hang out in that area. You want to put the pressure on. Usually those tender spots, they're called trigger points. And they're little areas of contracted muscle. So we can get rid of these. And I'm showing you today how to get rid of them. You just want to think about hanging out where it hurts. Okay, so you're going to keep going. Just keep massaging. Just to really warm up the muscles. You can get into the neck a little bit if you want to. Okay, so then what I'd like you to do now is to hike up your shoulder and grab that tissue. Okay, this is our trapezius. Okay, this muscle is called your trapezius. I want you to grab that tissue and then allow your shoulder to drop down and let your fingers melt through the muscle. So you're going to do everything by threes. So this is our second time. Hike up the shoulder, grab that tissue. Probably see me better like this. Grab that tissue, and then as you drop your shoulder down, let the muscles just melt under your fingers. And again, it always helps if you can close your eyes, because you'll find that you'll feel a lot more. Okay, so this is our last squeeze. And lovely. Okay, we're going to stick to this right side. Okay, and the next thing we're going to do, we're going to get our fingers like so, by fours. And what you're going to do now, instead of lifting and grabbing the tissue, you're going to sink your fingers into the fleshy part of your back and really slowly, as slow as possible, really sink those fingers in and let the muscles melt and ease underneath your fingertips. Okay, do it again. Try and grab a different area if you can. Just think about letting those muscles release, finding any tender spots, sit in those areas. Now I've just found a very tender spot right over here. So I'm just going to sit and I'm going to hold it for at least 30 seconds until I feel that pain reduce. And then as you feel the pain reducing, gently bring those fingers, let them drag underneath, releasing all those muscles, and realigning those muscle fibers. Okay, lovely. So we are now going to massage a very important muscle in our neck. It does a lot of the turning left and right. In fact, I will show you all a photograph so you'll know what you're looking for. It is called the sternocleidomastoid. It's a big name and a big muscle. So if you can all see here, you have this muscle. Now, if we think about it in our neck, for sticking on this right side, you drop your chin to your chest and tip your head to the right hand side, you should be able to grab it. Yeah, I'm hoping you found it. If you haven't, perhaps just move around a little bit and you will find it. It's attached to our collarbone, just here, and it begins just here, behind the bone, underneath your ear. So what I'd like you to do is find it from the bottom, and we're going to just do small circular motions, very small movements. You're going to grab that muscle, literally pull it. You can be aggressive, nothing's going to happen. Be careful of your throat. You'll find there's probably a tender spot around there, so you want to keep to the right hand side. And we're just going to make lovely small circles. Now again, you might find really tender points in here. If you find those tender spots, I want you to really hang out there. Okay, I want you to hold. And if you don't find any, that's okay too. Just keep going up and down this muscle in lovely circular movements. Okay, we're just going to go up one more time. So again, I've kind of lost it. If you lose it, try and find it where it is again, and then just grab it. Okay, next we're going to stick on the right side. And what I'd like you to do now is to get your hand into a fist, like so. Now again, everyone's going to have different shaped necks. Some are shorter, some are longer, some are wider. So what we're going to do now is we are just going to take 2 knuckles. For me, it works with 2 knuckles. Some of you might find 3 okay. And you're just going to, again, bring your right ear towards your right shoulder to slacken off the muscle. Sorry, my microphone's just dropped out my ear. Sorry about that. Okay, so what I'd like you to do is drop that ear down to the right, and while the muscle is slack, you can then just get those knuckles and really work your way from your collarbone around the front area and just go all the way up to your ear, just underneath your ear, the mastoid process. Now, you can bend your head to the left, and then you will find that you can probably apply a bit more pressure that way. Now, everyone's going to be feeling it in different areas. You're going to have different spots of sensitivity. So you just want to work all the way around. You can start using your fingers if you like, until you can get more of the neck. So we're just going to go up and try and get right into the base of the skull where you feel the dip. Bring those fingers up, or knuckles, whatever you find comfortable. You might find just using your thumb might be easier for you. Okay, we're just doing nice, deep, long strokes. Wonderful. Okay. So next we are now going to do it all again on the left side. So what I want you to do first of all is get your lotion and try and get some of the skin, whatever you've got to grab onto. If you can't get underneath it, you can do this on top of your clothes as well. So maybe you're at work and you're doing this in your lunch break, I don't know, and you might have the shirt on. You can go over the top. Obviously, it's not as good, but that's okay. So we're just going to warm the muscles up, just really trying to get these bits all around here, just to warm them up. That's it. Really get in there. Yep, just keep doing it. Okay, and now we are going to grab this piece of tissue. We're going to grab our trapezius. So we're going to bring our shoulder up, grab whatever you can, hold on to it, and as you drop your shoulder blade down, just let the muscle and skin go between your fingers. So grab, lift, and release. And we'll do it one more time. Grab and lift. Drop that shoulder down and release. Okay, so now we are going to find the sternocleidomastoid, okay, on the other side. So, again, try and find it, okay? You might need to drop your head forward, tilt to the opposite side to the left, and get those 2 fingers and thumb, and start from the bottom, gently grabbing it. Be careful around the throat area. And just massage up and down. Find those areas of tightness, any sore spots, like I said, hang out there. Hold. And usually after about 10 to 15 seconds, the pain does release a little bit. Okay, so now we are going to go into using our knuckles again. So I just want you to take either 2 knuckles, three knuckles, your thumb, and again, you tilt your head to the left to give the muscle a bit of slack. And then as you're working your way up, you can then tilt your head to the right, and you will feel that increase in pressure as you tilt your head to the opposite side. You don't have to. You again just stay wherever's comfortable for you. Okay, and it's just working your way towards the back. You might find as you're working towards the back, you might just want to use your thumb. You might find it slightly easier to access. Again, we're trying to work all the way in to the suboccipitals, which is the base of your skull. Okay, lovely. So now, how about we all just give our shoulders a nice squeeze, bring the shoulders up, give it a squeeze. And what we can do again is let's turn around. Now, remember you're going to have your 4 fingers like so with each hand. And again, grabbing whatever you can and really slowly, slowly, slowly allowing the muscles to melt through your fingers. What I want you to do now is to get your fingers in this position, and we're going to start at the base of the skull and work our way down the spine. You're going to spread out that tissue opposite ways. So really getting in there, either side of the bone, so either side of that cervical spine, spreading that tissue out and working your way down and around. You can bring it down to your collarbone. And then we'll start again at the top, really opening up and spreading that tissue. Again, working your way down the spine. Okay, lovely. So one last thing I just want you to do for me is, again, interlace those fingers, put your hands behind your head, lift up that tissue and bring your chin to your chest. And bring your head up for me. And now we're going to do it one more time. This time we're going to bring our head up, pull the tissue up. When you drop your chin down, I want you to resist against your hand. So pushing back towards your hands. And this way you'll find, again, a deeper stretch. Remember to breathe. Remember, if anything feels uncomfortable, stop. Okay, bring your head back up again. Now we're just going to finish off. You might need a tiny bit more oil. Just going to finish off doing some nice chest, opening up our chest area. So you can feel all through these muscles. This feels really, really good. You can work all the way across, even across the shoulder. I need a bit more oil. Okay, and just again, a lot of the time the key is going slowly, so you can really feel the muscles underneath. And you can kind of feel yourself realigning right back into there. So just do it on the other side now. Just really trying to open up that chest. Okay, lovely. Well, I hope you enjoyed that. This is my first live webinar, so I was a little bit nervous, but we will now finish with a small reading, a little bit of mindfulness. Okay, so I just want you now to sit comfortably on your chair with your back straight, your feet uncrossed and flat on the floor, with your arms resting on your legs or in your lap or on top of one another. And I want you to spend a few moments taking in your surroundings, closing your eyes, really concentrating on that breath, and those shoulders nice and relaxed. And gently close your eyes and tune in to the inner environment of your body. Become aware of the weight of your body, the contact between your body and the chair, and the sensation of the soles of your feet on the floor. Feel the weight of your hands and your arms resting on your legs or lap. Just take a moment and notice how the sounds are around you, both inside and outside the room. You don't need to grab onto or worry about the noises. Just let the sounds be. Tune in to the feeling of the air on your face and your body, and notice whether you are warm or cool. Now, slowly bringing your attention gently to your breath, noticing where you feel the breath in your body. You don't have to worry about the breath or try and change it. Just be aware. You might be able to notice the small movements that you don't usually pay attention to. Maybe you feel them in your belly or in your chest. There are no rights or wrongs. You're just gently observing. Follow the in-breath and the out-breath with your full attention, like the waves of the sea, ebbing and flowing. After the next breath, just notice the slight pause, the stopping and the stillness before the next breath in. Just notice the quality and the rhythm of the pause, and let the next breath in come when it wants to, almost like the breath is breathing you. You may find as you notice the pause, it naturally becomes longer. You may find it helpful to count the breaths. As you feel the rising sensation of the breath, you can count 1. And as you feel the falling sensation of the out-breath, you count 2, just silently to yourself. And continue counting in that way up to 10. So it's 1 with the rise of the breath and 2 with a fall. 3 with the rise and 4 with the fall. And 5 with the rise and 6 with the fall. And 7 with the rise and 8 with the fall. And 9 with the rise and 10 with the fall. When you reach 10, you can always stop and start again in your own time. It doesn't matter if the mind wanders, it's quite normal. But as soon as you've noticed that it has wandered, gently bring it back to the act of counting your breaths, stopping at 10 and starting again at 1. When you are ready, just bring your attention to your body. Notice the physical sensation of your body pressing against the chair, and then your feet resting on the floor, and your hands and arms resting on your legs. Notice the sounds inside and outside, and any obvious tastes or smells and sensations. So bringing yourself back to your senses, back to your immediate environment. And in your own time, just bring yourself back into the room and open your eyes again. Okay, well, I'd like to thank everybody who participated today, and I really hope you'll come back again. I will be doing different types of massage techniques on different parts of the body, and there's all our other team members that will be doing different types of relaxation techniques each day. And obviously, if you liked what you had today, and if you want to support our charity, please do so, tdf.org.uk. Thank you, and I hope you have a nice day. Bye for now.